If you've had weight loss surgery and you are going through a weight loss stall, this video is for you. My name is Dr. Arun. I'm a gastrointestinal and a bariatric surgeon, and I've practiced my craft now for over 3 decades. I often see patients who have had gastric sleeve and gastric bypass procedures, and they get worried a few months down the track when they are going through a weight loss stall. It is also called a bariatric plateau. It can last anywhere from 3 weeks to 3 months. And in this video, I'm going to be sharing with you 5 reasons why individuals go through a weight loss stall and what are the 5 strategies to overcome this. So, first thing, let's be very clear that weight loss after bariatric surgery is not like a straight line which is going down. It is often described that the weight loss is in a step ladder fashion. So it plateaus for a little while and then suddenly you will see a drop. Then again it will remain flat for a little while and again you will see a drop. What is important to recognize is that there are 5 key reasons, which is the reason why an individual goes through a weight loss stall. Some of these can be fixed, some of these are physiological, which means they are normal and it will eventually settle down. So the 5 reasons are, number 1 is portion size. Now, if we don't understand that with a period of time, with the passage of time, your portion size will increase. That's called normal adaptation. And I think if we are clear about this, that if we focus mostly on good quality nutrition, which has got a balance of protein, healthy carbohydrates, and healthy fats, along with fiber, this adaptation is perfectly normal and will not significantly impair your long-term ability to maintain weight. The second reason why you may go through a stall is if you are getting into heavy exercise quickly. What I mean by that is that when you get into resistance training and all of that, you start to build more muscle. When you're building more muscle being heavier than fat, it is going to show up as a weight loss stall. The third reason is if you are not getting adequate sleep. When you don't get adequate sleep, it starts to play up with your hunger hormones. If you're sleep deprived, you will naturally go for caffeine and sugar-infused drinks and foods. That will start to impact on the choices that you are making, and it will lead to a weight stall. The fourth reason is that of stress. Anytime there is undue stress which is prolonged, acute stress or short-term stress is different to a long-term stress. If there is a long-term stress, and I'm talking about days on end, weeks on end, what that does is it starts to create this hormone cortisol, which is going to stay at higher levels, and cortisol creates a state of fight or flight response, which means the body thinks there is a stress, there is a threat, there is a danger out there, which is why this is not a time to lose weight. Rather, it's a time to conserve energy, to hold on to energy, which is where individuals start to see that they are not losing any weight and they get more frustrated, which adds to the stress, and it is a vicious cycle. And the fifth reason which applies to women is that it is the hormonal cycle, especially when you're going through the menstrual cycle on a monthly basis. When you are in that ovulation phase, it leads to fluid retention, and that fluid retention is obviously reflected on the scales as weight gain. What can you do about these 5 things? So here's what I often say. For the first strategy where your portion sizes have changed, it is a good idea to speak to your dietitian or nutritionist to get an idea about how to create balance in your meals. Secondly, when it comes to the exercise side of things where you're building more muscle, well, that's a good thing. But how you measure it is you use body composition analysis, because that tells you it's a very easily done test, and it can be done by going to a gym. Most of the gyms have got the body composition analyzer machines these days, and you can test what is your muscle mass, body fat percentage, and also your visceral fat, because all these things give you a good idea about what your body composition is like. As far as the third strategy, which is the sleep, goes, it's a good idea to use a sleep tracker and also asking yourself the question, did you get a good enough sleep, and how do you feel in the morning? Do you feel fresh after your sleep? Also, reducing your alcohol consumption in the evening and also making sure that you're not on screens before going to bed will improve your sleep quality. As far as stress goes, I think there are various strategies that have been mentioned about stress management, and the more that is said, it is still less, because we are always seeming to be surrounded by various kinds of stress. And I often say this, that stress is going to be there in your life. You have to learn the skills to manage stress better. I often talk about mindfulness-based stress reduction strategies, meditation, walk in the woods, developing hobbies such as music, gardening, singing, whatever takes your fancy. And the hormones, of course, we know that it is about fluid retention, making sure, this is for the women, that your cycles are regular and you have a follow-up with your medical practitioner to essentially look at your gynecological health. So I hope you found this video useful. If you did, give it a thumbs up, and I look forward to seeing you at the next video.